guys, welcome back to the Pharmacotherapy series on Pharma Palette. In part 1, we discovered how the hyperlipidemia silently increases the risk of heart attack and stroke. Now, in this video, we are going to learn the complete pharmacological treatment of hyperlipidemia in the easiest way possible. So, we'll cover the statins, fibrates, niacin, ezetimibe, all other important drugs that are used under this treatment. So, along with the treatment algorithm. So don't worry about memorizing this long drug list. I'll show you simple flowcharts and memory tricks so you can remember the entire thing with ease. Again, so grab your notebooks and let's master this. So in the pharmacological treatment, the first class of drugs are the bile acid sequestrants. These are simply the resins. Coming back to their mechanism, so in this condition, the bile acid will be binded in the intestine. When it gets binded, it will be preventing the reabsorption. So when the reabsorption gets prevented, the bile acids will be lost in the feces. So more bile acids will be lost in the feces. In this condition, the liver will be using more cholesterol, due to which it reduces the LDL cholesterol. Now, how do you remember this mechanism? With simple trick. So just remember it as BBBLL, where B means it is bind, B means it is block, B means bile out, L means liver uses, L means it is LDL decrease. So bind means it is binding to the intestine. Block means it is blocking the reabsorption. Bile out means it is allowing bile is getting eliminated from the feces. And liver uses means it is using more cholesterol. So it is causing reduction in the LDL. So just remember this simple trick so you can remember the mechanism. So coming back to the indications. So this bile acid sequestrants can be given along with some other drugs also. And usually it is given to treat the mild to moderate increase in LDL. Given for the primary patient. It is given in males, especially the young adults, and it is given in the women who are under the postmenopausal stage. So coming back to the drugs and doses. So here bile acid sequestrants, you'll have two examples. One is cholestyramine and cholestyramine. So cholestyramine 4 to 24 grams per oral can be given twice in a day. Cholestyramine 2 to 16 grams, it is also given through oral route. 1 to 4 times in a day, daily it is given. Second class of drugs that are used in the treatment of hyperlipidemia is the HMG-CoA reductase inhibitors, which are simply called as statins. So what is the mechanism under this? So usually they will be inhibiting the HMG-CoA reductase enzyme, due to which it will be reducing the cholesterol synthesis in the liver. When this happens, the LDL receptors will be increased on the liver cells. When that happens, more LDL will be taken out of the blood. That will be leading to reduction in the LDL, reduction in the triglycerides, and increases the HDL levels. So HDL is the good cholesterol, so it is increased. So LDL and triglycerides, which is a bad cholesterol, will be reduced. And this HMG-CoA reductase inhibitors are one of the most effective drugs which are mainly used in this treatment of hyperlipidemia. And coming back to the indications, these are given when the patient is having high LDL levels or mainly to lower the heart disease risk. This will be given. And the next most important thing is that this HMG-CoA reductase inhibitors are the first choice drugs for most of the patients. So coming back to certain doses and drugs used in it. So atorvastatin can be given at a dose of 10 to 80 mg once in a day. Fluvastatin 20 to 80 mg once or twice in a day. Lovastatin 10 to 80 mg can be given in the evening time. Pitavastatin can be given at a dose of 1 to 4 mg once in a day, and pravastatin 10 to 80 mg once in a day, rosuvastatin 5 to 4 mg once in a day, and simvastatin 5 to 80 mg given in the evening time. Third class of drugs that are fibrates, simply the fibric acid derivatives. So the mechanism involved is that they will be activating one receptor, that is PPAR alpha receptor, which will be increasing the lipoprotein lipase activity, due to which it reduces the VLDL levels in the body, thereby reduces the triglycerides also. So it reduces the VLDL production, so it reduces triglycerides. Then sometimes it also reduces the LDL and increases the HDL. So this is the mechanism of fibrates. Coming back to the indications, this is given mainly in case of high triglycerides, especially if the VLDL levels in the body are more. this fibrates will be prescribed. This is also given in the mixed dyslipidemia condition, and when the statins alone are not enough to reduce the cholesterol, this fibrates will be added to the treatment. And coming back to certain doses and drugs, so fenofibrate 145 to 160 mg once in a day can be given. Gemfibrocil 600 mg twice in a day can be prescribed. Coming back to the next drug that is used in the treatment is niacin. Niacin is simply the vitamin B3. So coming back to the mechanism, niacin usually works by many ways. First thing is by reducing the VLDL production in the liver, thereby causes the decreased breakdown of the fat in the adipose tissue, that will be leading to decreased formation of the fats in the liver, thereby increases the activity of lipoprotein lipase, finally resulting in reduced LDL levels, reduced triglyceride levels, and increased HDL levels. And the next one, coming back to the indications. So this niacin can be prescribed if the patient is having high total cholesterol levels or low HDL, increased triglycerides, and this niacin can be used in the combination therapy. So coming back to certain doses used, this niacin is available in the form of controlled release and immediate release. So in the controlled release, 1 to 2 grams per oral or 1000 to 2000 mg per oral at bedtime will be given, and in case of immediate release, 1500 to 3000 mg per oral 2 to 3 times daily can be prescribed. So coming back to the last drug under this treatment, so ezetimibe. So the mechanism is that it will be blocking the cholesterol absorption from the intestine, and also the plant sterols from the intestine will be blocked, due to which the cholesterol which is reaching the liver will be less. So that why thereby the cholesterol stores which are present in the liver gets reduced, due to which the more cholesterol gets removed from the blood. When more cholesterol gets removed from the blood, it will be leading to reduction in the total cholesterol, reduction in the LDL and triglyceride levels, thereby increases the HDL levels. So coming back to the indications, first thing is this can be given along with the diet when the statins are not enough. And the next thing is it can be given to the primary heterogeneous, familial, and the non-familial hypercholesteremia. That means this can be given in combination with the statins, especially for homozygous familial hypercholesteremia. So coming back to the dose, so 10 mg per oral through once in a day can be given. So coming back to the last part of the video, the treatment algorithm. So if a patient has hyperlipidemia, the first thing you will be doing is to check the lipid profile. So in the lipid profile, you'll get to know the levels of LDL, triglycerides, HDL, and all the total cholesterol in the body. And after getting the results, first thing you'll be going with is the lifestyle modifications, which is a non-pharmacological therapy. So after doing this non-pharmacological therapy, even though the symptoms are still not controlled, at that condition the pharmacological therapy will be started. So where you'll be checking the LDL levels. If LDL levels in the report are more, you will be going with the first choice of drugs, that is statins. So the second one is if triglyceride levels in the body are more, like if it is more than 500 mg per dl, at that condition fibrates can be used if the LDL goal is achieved. Like if the LDL levels are reduced, you can continue the statins. If the LDL levels are not reduced, you will be adding one more drug, that is ezetimibe. And even after giving this drug, if the symptoms are not yet reduced, at that condition you will be going with the newer class of drugs, that is PCSK9 inhibitors. So that's the complete pharmacological treatment of hyperlipidemia. So before you leave, let's do a quick 10-second revision. So statins will lower the LDL. Fibrates are best for triglycerides. Niacin will increase the HDL. Ezetimibe will block the cholesterol absorption. Resins will remove the bile acids. So if you can remember these 5 points, you have already mastered the treatment. Remember, in exams, the difference between confusion and confidence is revision. If you revise this 3 to 4 times, hyperlipidemia treatment can become one of the most easiest pharmacotherapy topics. So if this video helped you learn better and easier, so make sure to like the video, share it with your study partner, and subscribe to Pharma Palette. And comment below which pharmacotherapy topic should I simplify next. So see you all in the next video, and thanks for watching.